Good morning, I'm Gabrielle Baliton, a nursing student from San Pablo Colleges. I am here to do the return demonstration of assessing the upper extremities of a patient. This is to check for the muscular strength of a patient. But before that, ma'am, I'm your nurse for today. What is your name? Is it okay with you if I'm going to touch the upper extremities?
Yes.
But before that, we need to perform hand hygiene to prevent virus to spread and provide clients privacy like closing the doors and windows. As you can see, my patient is sitting already in the examination table, and now I'm going to expose the left and right upper extremities. After exposing the left and right upper extremities, I'm going to inspect the skin for color, tone, and the presence of lesions, masses, and textures. After that, I'm going to inspect the muscles for size, contractions, and tremors. And then I'm going also to palpate the extremities for the deformity. After that, I'm going to palpate the clavicle, then the acromioclavicular joint, the coracoid process. After that is the bicipital groove and the biceps and triceps. After that is the epitrochlear nodes. After that is the brachial pulse, the medial and lateral epicondyles, the olecranon, the cubital fossa, the radial and ulnar styloids, the carpus, the metacarphalangeus joint, then the proximal and distal interphalanges. And do it to the other one. And now I'm going to check the range of motion of my patient by asking her to place her arms at the lap for pronation, then move them all the way above the head for extension. Then move her arms down at the back for the hyperextension. Put your arms at the lateral aspect of the body, then put them above the head for adduction, then move the arms back down across the chest. for abduction. And place your arms with the elbow flexed behind the head for the external rotation and bring back down to the lower back for the internal rotation. Then now I'm going to check the range of motion of the patient against resistance by asking my patient to lift her arms at the side. Then ask the patient to resist as I push them down and pull them up. Keeping the elbows flexed with wrists closed. Then ask the patient to resist as you push and pull to and away the shoulders. Keeping the elbow at the side, ask the patient to bring down her hands at the pronated position and open up. Then ask the patient to flex his wrist up and down. Keeping the wrist in the upward position and ask the client to resist as I pull them down. Then ask the patient to bring down the wrist. Then ask the patient to resist as I pull them up. With the elbows still at the side, ask the patient to pull them in. Pull the hands in for the radial deviation. Then pull the hands out for ulnar deviation. Then now, ask the patient to spread the fingers on both hands. Then ask the patient to resist as you try to pull them close together. Now I'm going to check the nails bed capillary refill. Now I'm going to check the strength of the hand of my patient by asking my client to squeeze two of my fingers. I'm done in assessing the upper extremities. It is important to document all the procedures you've done. Again, I'm Gabrielle Baliton. Thank you.